I did my infectious disease over gonorrhea, and I think that this is so important because it is the second leading STD right now. Okay, so gonorrhea is a gram-negative Diplococcus neisseria gonorrhoeae. I think I'm saying that right. These organisms, they attach to the epithelial cells of the male and female urethra, causing urethritis. So basically, if, say, a woman has gonorrhea and she has sex with a male, the gonorrhea will actually go in the penis through the urethra. And whenever your body sees an infection, of course, your white blood cells rush to the urethra and they will destroy the cells, but most of the time, more than one epithelial cell is affected, so it doesn't kill it all off. This gram-negative coccus tends to grow in pairs that are kidney bean shaped, and it forms oxidase positive colonies. So you can get gonorrhea. A bunch of people think it's just through sex, but it's actually any sort of sexual contact and childbirth. This is why women who are pregnant are tested around 12 weeks of pregnancy to see if they have it. And I know it was standard where I was to get tested again around the 30-week mark to ensure that you don't have it, because childbirth can also pass it along. And a baby has it, they get crust over their eyes, and they display other symptoms also. So it's really sad, and it's really important to get tested to ensure your baby doesn't get it. But signs and symptoms of gonorrhea. The scary thing is that symptoms are not always present, or if they are, people think it's something else and brush it off. So that's why it's important to have your yearly appointments, and if you have any questions, go to the doctor, because it's serious. But in males, yellow, white, or green discharge may come out of the penis. Burning or pain when urinating is a big sign, and also pain and swelling in the testicles. Sometimes the gonorrhea can go all the way from the urethra all the way up to the testicles. It can go all the way up to your spinal cord, your synovial fluid. You can get meningitis, you can get arthritis. This is why it can just lead to a bunch of really, really bad things. And in females, pain or burning while urinating also. Abnormal discharge that's yellow or has a bloody consistency to it. And also bleeding in between your menstrual cycles. That's a good sign that something might be going on. There was 309,341 cases in 2010, and 100.8 per 100,000 cases in the population. And it's still on the rise, and the highest reported cases were just in 2015. And this can be contributed to a lot of things, but I would think that social media has a huge part in that. With the apps nowadays, it makes it really easy to engage in sexual contact with anyone and everyone, and you don't know who you're getting involved with, which is really scary. So the diagnosis: a sample of cells is taken through urine or swab test. If you're displaying symptoms in your reproductive organs, they will swab there and send it off for testing, or they'll do a urine test. So treatment, usually for standard cases, most people, you'll take 2 drugs. One is 250 milligrams of intramuscular cetirizine and 1 gram of oral azithromycin. And not sure if I'm saying those right. But so usually you'll take those, and they'll tell you not to engage in any sort of sexual contact for at least 7 days. So it's really important, because you may get rid of the symptoms, they'll call you back in, test you, and it's still not gone, so you may have to take more medicine. So it's really important to not do that for 7 days. Come back in, get tested again, make sure it's gone. Prevention, obviously abstinence. I don't think that's very doable, but condoms for sure, so safe sex, staying with one partner, or getting tested. You and your partner should get tested before engaging in any sort of sexual contact to ensure you're not passing it off and that you're not getting it from someone else, because it is so contagious and it's not hard to get. Like I said, you can get contact in your urethra, it can travel up, it can even, one of the biggest things, here's a picture of it, right here I'll point to it, right here, these are your fallopian tubes. So every month a woman ovulates and an egg goes through this tube, and if she is trying to get pregnant, gonorrhea, you can actually get scar tissue like right here, and it can build up and block your fallopian tubes, which will lead to a woman not being able to ovulate, which means she will not be able to get pregnant. Gonorrhea can also lead to early miscarriages, can lead to a lot of reproductive problems. So that's why it is so important to practice safe sex, get tested, and know all of the symptoms, what causes it, and just knowing what you can do to prevent it. And also, here are my sources.